The new panel of vaccine advisors to the CDC made its first decisions today, and it is their first official move after Health and Human Services Secretary Robert F. Kennedy Jr. fired the former experts, replacing them with his own picks. A majority of that panel approved recommendations for a new shot targeting the respiratory virus known as RSV. It also voted to urge Americans to avoid a small amount of flu vaccines that use a certain preservative despite evidence showing its safety. CBS News health reporter Alex Tin has been covering all this. He joins us now. And Alex, walk us through the committee's actions, particularly when it comes to this RSV shot today.
Yeah, it's interesting, Nancy. You know, the way that the committee reached this RSV shot decision in some ways was a window into an alternate reality where the panel's membership hadn't changed and a different administration was in power. You know, you had the culmination of the usual process. A new RSV shot that was recently approved by the FDA has gone through months and months of rigorous review by work groups within the CDC, gathering input not just from experts, but from public health officials, understanding, how would an updated recommendation to include this new RSV shot impact stakeholders? How would it impact health insurers? How would it impact doctors? How would it impact parents? Is it safe and effective? And as the result of all of those deliberations, they presented these proposed recommendations to the committee. The committee signed off on them by a majority vote. There was only one person who voted against it. But, again, this was a window in some ways into the usual process, the usual result we would have seen if the panel hadn't changed.
And Alex, we've also been talking about the panel urging Americans to avoid a specific preservative that's seen in some vaccines. Why is that? And what do average Americans need to know about this?
Yeah, if the RSV shot was a window into the alternate reality where the membership hadn't changed, the way that this recommendation played out is in some ways the exact example of everything that folks, in medical groups, in Democrats, in former health officials, that they were fearing would happen as a result of changes to this committee. You had the presentation by one person, Lynn Redwood. She's the former head of Children's Health Defense. That's the anti-vaccine group that Health Secretary Robert F. Kennedy Jr. used to be the founder and chairman of before he became the nation's top health official. That Lynn Redwood presentation was followed by a brief discussion by some of these panelists, a handful of objections that were aired from the public comment period and from some liaison groups. And their frustration was that, look, yes, it's true. Thimerosal, this vaccine preservative, it's pretty rarely used in the United States. Most vaccines probably don't have it already, so it's not going to make a big difference for most people. But it bypassed the usual time-tested processes by which the CDC gathers all of this information, all this data to make sure that its recommendations are evidence-based, aren't biased, aren't unfairly impacting certain groups. All of that process was railroaded, and a CDC review that was debunking some of the claims underlying this change, that review was taken down.
And Alex, as you well know, insurance companies are closely watching the decisions this panel makes. What impact will these decisions have when it comes to getting these shots covered?
Yeah, I mean, look, the reason that health insurers, health authorities, health officials watch the decisions of this committee so closely is because it's directly tied in federal law to the requirements for what vaccines health insurers are required to cover. The reason that matters isn't just because, in a best case scenario, okay, if the vaccine committee changes its recommendations, that means that the vaccine is going to cost more at the pharmacy. That's true. But in a lot of cases, if insurers aren't covering vaccines, that means that pharmacies aren't going to stock those vaccines, doctors' offices aren't going to stock those vaccines, and it becomes a whole lot harder to get those vaccines, even if you want to get one.
Something so many Americans count on, too. Alex Tin, thank you very much for your time.